Hi, I'm Dr. Bill Berkowitz of Life Chiropractic in Grass Valley. Welcome. Let's talk about 4 critical choices to a fibromyalgia treatment options. I think this is really critical. Remember, you always have options. In medicine, they are completely confused about fibromyalgia, and the best they can offer you is temporary symptomatic relief with medications that always have unwanted effects. I don't call them side effects because there's cause and effect. Some just are unwanted. Let's look at this from a vitalistic model. This is a model that supports the body in doing its healing. 3 critical aspects of vitalism when it comes to human health. One, that the body is self-monitoring. It is always evaluating what's going on in the body. Thousands upon thousands of reactions. Breathing, blood pressure, heart rate, digestion, hormones, neurotransmitters, oxygen, glucose, and it goes on and on. The body is self-regulating. All those things that it is monitoring, it is continually updating, refining, adjusting the levels of those things, all in an effort to maintain balance, or what is called homeostasis. And it is self-healing. So, if you have fibromyalgia, you're not healing. And the question is why? Well, one thing to look at is something has created an imbalance in the body so that it is not able to adequately monitor, regulate, and heal. What if we tried to assist the body in returning to balance? The cause, as in the cause for well over 90% of all illness and disease, especially chronic illness, is stress. We can't undo stress, we can't go backwards, and really managing stress is a recipe for disaster. But what we can do is change how the body responds to stress. Bring it back to balance. So here are my 4 options. 1, I want to make sure that you're in structural balance. When we look at you, we want to see your pelvis, your shoulders, and your head level. If they are not level, you are adding additional stress every time you sit, every time you walk. So we want to bring you to structural balance. 2, we want to make sure that the upper cervical spine, the top of the neck, is in alignment and moving. This is where the brainstem is. The brainstem is home to the autonomic nervous system, which controls everything that you want. And when the upper cervical spine is out of alignment, it puts pressure and creates an activation of the sympathetic fight or flight system, creating the kinds of pain, inflammation, disturbed sleep that you see in fibromyalgia. 3, we want to make sure that the spinal motion is good throughout the entire spine. Special emphasis on the upper cervical spine, but actually throughout that. In the mid and lower back, we want to make sure we take pressure off of that fight or flight system so it's not overactivated. But motion in joints reduces pain. Restricted joints amplifies pain. And the 4th option is we want to activate the vagus nerve. Long-term stress inhibits the vagus nerve because it activates the sympathetic fight or flight system. That drives up muscle tension, that drives up inflammation, that drives up pain, that disturbs sleep, that impairs digestion, impairs recovery, inhibits the immune system. So we want to activate the vagus nerve. Not just take pressure off of it, not just remove irritation and interference, but we want to exercise the vagus nerve because it has likely been years since your vagus nerve was robust, healthy, and had a good tone, because your vagus nerve is your pathway to well-being. That's the 4 options that I focus on. There are certainly other things. We would want to talk about sleep. We would want to talk about some support to the hypothalamic pituitary adrenal axis that gets overstressed over years and help that heal. But those are the first 4 core things that we want to address in terms of addressing fibromyalgia. Make sure to subscribe to all of my social media channels, and also you can find a lot of more information, as well as if you want to book an appointment at my website, Life Within Chiropractic. Thank you so much.